He told me he wasn't afraid of needles. He said it the way people always say it, a little too quickly, a little too firmly, like he was trying to convince himself more than me. And then he sat down on the edge of my kitchen chair, gripped his own knee with both hands, and stared at the wall like he was preparing for something much worse than a simple intramuscular injection. I almost smiled. Almost. His name was Daniel. He was my neighbor's younger brother, visiting from out of town, and he'd come down with something, a low-grade fever that had been dragging on for 3 days, a prescription from an urgent care clinic folded in his jacket pocket, and absolutely no one in the city who knew how to give him his shot. My neighbor, bless her heart, had knocked on my door at around 9 in the evening with this man standing behind her, like a very tall, very embarrassed shadow. "She's basically a nurse," my neighbor said, which is not exactly what I am, but close enough for a Tuesday night. I looked at him. He looked at me. He said, "I'm not afraid of needles." Right. I asked him to come in. I made tea first, because that's what you do when someone is quietly terrified and trying very hard not to show it. There's a rhythm to these moments. You don't rush them. You let the kettle do its work. You let the person in your kitchen start to breathe at a normal pace again. I set out 2 cups, which surprised him, I think. He'd expected efficiency, clinical, in and out. He said, "You don't have to." "I know," I said. "I want to." And I did. There's something I genuinely love about these unexpected moments of care, the informal ones, the ones that happen in real kitchens with real people who are a little bit scared and a little bit grateful and trying so hard to look like neither. While the tea steeped, I asked him about the prescription. He unfolded it from his pocket, slightly crumpled, slightly damp from his nervous hands, and I smoothed it out on the counter. Reading a prescription sounds simple, but there's a particular skill to it, especially when someone hands you something and says, "The pharmacist explained it, but I kind of stopped listening after the word injection." The prescription was for an antibiotic, intramuscular administration, a standard dosage written in that particular doctor's shorthand that looks like a secret language but isn't, once you know what you're looking at. The abbreviation IM means intramuscular, into the muscle, not under the skin, not into a vein. The route matters enormously. The same medication given the wrong way can be ineffective at best and genuinely dangerous at worst. I explained this to him, quietly, over tea, and he listened with the focused attention of someone who has recently become very invested in the details. He also had a mild fever. He mentioned it almost as an afterthought. I asked if he'd been alternating anything for it. He hadn't. I told him that for a low-grade fever, something like ibuprofen or acetaminophen works well. But the key is consistency. Not just taking it when you feel terrible, but staying ahead of it. Every 6 to 8 hours, with food, plenty of water. Fever is the body doing its job, but you don't have to suffer through it heroically. There's no medal for that. He laughed a little at that. The tension in his shoulders dropped, just slightly. Good. I washed my hands, properly, the way you're supposed to, not the 30-second rinse that most people think counts, and pulled on a pair of gloves. There's a particular feeling to that moment, the snap of latex settling over your fingers. It's a small ritual. It signals something. We're doing this now. We're being careful. You are safe. I asked him to stand and turn slightly, and I explained what I was looking for. The injection site for an intramuscular shot. When you're using the gluteal muscle, which is the most common site for this kind of antibiotic, is very specific. You're not guessing. You divide the area into quadrants mentally, and you work in the upper outer section. That's where the muscle is thick enough to absorb the medication properly, and that's where you avoid the large nerves and blood vessels that run through the lower regions. This matters. This is the difference between a shot that works and the shot that causes real harm. I pressed 2 fingers lightly to find the landmark, the posterior superior iliac spine, which sounds very technical, but is simply a bony point you can feel, a reliable anchor. From there, I knew exactly where I was. "You're going to feel pressure," I told him. "Not pain, pressure." He said, "That's what they always say." "And they're usually right," I said. "Usually." He made a sound that was almost a laugh. I drew up the medication, checking the vial twice, which is not paranoia, it's habit, and good habit, and tapped the syringe gently to move any air bubbles up toward the needle. Then express them out. No air into muscle. Simple rule, non-negotiable. I cleaned the site with an alcohol swab in a circular motion, outward from the center, and let it dry. This is a step people skip. Don't skip it. Wet alcohol on the skin when the needle goes in stings more than it has to. And it also hasn't fully done its job yet. 10 seconds, that's all it takes. I told him to shift his weight to the opposite foot, to relax the muscle I was about to inject. A tense muscle is harder to penetrate and more painful afterward. A relaxed muscle accepts the needle almost without argument. "Think about something boring," I said. "Like what?" "Taxes, a long meeting, whatever works." He said, "I'm going to think about the tea." I said, "Perfect." The angle is 90 degrees, straight in, confident, not hesitant. Hesitation is what causes pain. A slow, uncertain needle is far worse than a swift, decisive one. I went in quickly, pulled back the plunger slightly to check for blood return. If blood enters the syringe, you've hit a vessel, and you stop, withdraw, start over. There was none. Clear. I injected slowly. The medication was thick, antibiotics often are, and slow administration into the muscle is kinder. 10 seconds, maybe 15. I kept my voice even, talking him through it without making a big production of it. Just presence, just warmth. "Almost done," I said. "I can't feel anything," he said, slightly amazed. "I know," I said. I withdrew the needle in one clean motion, pressed a small piece of gauze to the site, and held it there for a moment. No rubbing. Rubbing can push medication into the wrong tissue layer. Just gentle, steady pressure. Done. He turned around slowly, like he wasn't quite sure it was over. There was something almost funny about his expression, this mix of relief and mild disbelief, like he'd been bracing for something that never arrived. "That's it?" he said. "That's it," I said. He sat back down at my kitchen table, and I pulled off my gloves and disposed of the needle properly. Never recap a used needle by hand. Never leave it loose. Always into a sharps container, or at minimum, a thick plastic bottle with a sealed lid if you're at home. Safety isn't just for hospitals. He wrapped both hands around his teacup and was quiet for a moment. Then he said, "You're very calm." I said, "It's easier when only one of us is nervous." He smiled at that, a real one, the kind that reaches the eyes. He had very nice eyes, actually, dark. A little tired from the fever and the travel and the stress of the week, but warm. We talked for a while after that, about nothing medical, about his drive into the city, about the weird pride people feel when they finally try a food they'd been avoiding for years, about whether tea actually helps anything, or if it's just a ritual we perform to feel less alone in difficult moments. I think it's the second one, personally. And I think that's more than enough reason to keep doing it. He left around 11, a little steadier on his feet, with instructions to finish the full course of antibiotics, even when he started feeling better. Because stopping early is how you invite the infection back, and it comes back meaner the second time. and to call his doctor if the fever climbed above 103 or didn't break within another day or two. He paused at the door and said, "Thank you, really." I said, "Get some sleep, drink water. Don't be a hero about the fever." He laughed once, soft, and then he was gone. I stood in my kitchen for a minute after the door closed. The 2 cups still on the table, the quiet that settles after someone leaves a space they'd briefly made warmer. There's a kind of intimacy in this work that I don't think people expect. Not the dramatic kind, not the kind you see in movies. Just the simple, ancient intimacy of one person saying, without words, "I trust you with this," and another person saying back, also without words, "I know, I've got you." That's the whole thing, really. That's all it ever is. I picked up the cups, rinsed them, turned off the kitchen light. Some nights, that's enough to feel like everything.